to have one of the most momentous years I think we've ever had, especially as we look at some of the blind shopping that opened just the other day. Some of you may be using web broker entities for quoting. Some of them have somewhat accurate pricing. They don't have accurate benefits for the most part. But I do want to touch on today as we begin some of the hurdles that we may be facing with other carriers. Talk to that specifically. I'm sure some of you have already been looking. Those of you that have not been looking will want to go through over the healthcare.gov website, where you should be using your blind shopping opportunity and making sure that everyone that you're talking to knows new prices. We're getting them set up, we're discussing with them, and we are focused on really writing this business. Now, depending, as I've talked about and stood on my soapbox for the last 6 months telling everybody to get ready, it's going to come, it's going to be here eventually. Guess what? It's here. Some people are telling me they don't have sound. Does anybody have sound? Or is it just one person that doesn't have sound? Is that what? Oh, okay, great. There's sound. Oh my goodness gracious. Hold on. Oh wow. Oh, happy day. Oh, it's going to be a good day today here at A&B. All right, so got to have a good time. Healthcare.gov, when we're looking at healthcare.gov, let's just talk a little bit about blind shopping. You should know how to go through this. You should be using this now, having conversations with your current block of business. Any new people that you're talking to, you should be capturing their information. You should be discussing with them what I would call almost a pre-enrollment conversation. And that conversation is going to look at pricing. It's going to look at network. It's going to talk about the how Florida Blue stacks up against the competition. And then that way you can address all of the negativity now. Now, depending on the strength of your salesmanship, some of you may or may not want to do this with your customer, depending on the county. So, for example, if you're looking in Broward County or you were looking in a county where we have competition, Pinellas County for that matter, Hillsborough County, we have competition. Yes, there are only a few. And there are only some counties where we have to deal with some of these headaches, but the majority of the 67 counties, as you are well aware, or you should be at this point, unless you're living under a rock, you understand that we are the only carrier in over 40 counties. The lowest cost carrier, I believe it's 52 when it all came out. We messed up a little bit at Florida Blue. As we said, these were always kind of predictions based upon industry intel and filings. We were hoping to be the lowest cost carrier in Broward County. Looks like we missed the mark by a few dollars, but it's not the end of the world. You've got to remember who our competition is, and everybody, you've got to have those talking points of who is our competition that we're dealing with. It's not like we're dealing with the United Healthcare, a well-known name. It's not like we're dealing with Humana, a well-known name. These are respected names in the industry. When you hear the words AM Better, when you hear the words Molina, you can kind of scratch your head. I said to a customer the other day in doing a little testing and some test pitching and presentation, said to a customer, well, we've got this AM Better company that's going to be a little less expensive. And the customer said, well, who's that? I said, exactly. So you have to really understand that you have to go down that path, and there's no reason not to invite that conversation, because if you put that conversation off to the back burner, you can do an enrollment and then find out later that they've changed. Let's take a little quick look together, making sure that everybody's comfortable. Has anybody not, let me ask this question, since we have a small crew on our call today, about 45 of us, has anybody not gone and looked at pricing? Is there anybody on the call that hasn't taken the time since this has been released to go and look at the pricing, see how things stack up? Because if it's not a good use of our time, I won't even bother doing it. We can move on to other things. So again, is there anyone that has not? I know some of you say you have. Anyone that has not? I'm going to assume that we're all listening, and 49 of us, okay, one have not. Anyone else have not? You have not? Have not. Yes, I have. Can't see blue care plans because blue care plans don't exist anymore in most counties. All right, let's take a quick look at it. So we'll address the blue care comment. Someone else asked me that last night. Let's use Pinellas as an opportunity. Remember, all you can do is you can go in here and you can type in the different county zip codes. This is going to give you a close estimate. We'll go to Broward County because that'll show us some competition that we may not understand. These next few questions when we're doing blind shopping really don't have to matter. This is just going to help you assess their quote. Is it you or is it you and other people? For our example, let's just use one person. Let's use a 40-year-old. Let's use a female. Remember, male and female, same pricing. The only thing that's going to execute a different pricing is going to be your tobacco user. We go to continue. Your age is 40. Perfect. We continue. And then we talk about our income. As we know, we've talked about this ad nauseum. The 2017 federal poverty level charts are in your Dropbox. We know that we have that chart, and that chart has changed. So you should have this printed. All of your team members should have this. So you're assessing A, B, and C variants, and then as well as a standard plan variant, that you could access. If that is a standard plan, know that you are going to be looking at the traditional. We're not talking about the standardized plans, and those are the ones that look like Medicare supplements. If we come back here, let's put in our income. If I was saying I was at $14,000 worth of income, I can click continue. Shows me an estimated savings. Well, that doesn't help me much because remember, some of our plans are only available on Marketplace. I've gotten the question a few times in the last few days. I can't find the My Blue plans. Where are the My Blue plans? My Blue. Where's My Blue? My Blue is only on Marketplace. So remember that. So when you've got someone that you know is in a county that we have My Blue, Blue Care is an exited plan that was from last year. This year, we still have Blue Care plans, but only in certain counties. Where they added My Blue, you will see My Blue. Okay, so that is only in those two counties as we've talked about in training. We move forward here. We have different options. We can skip this. Let's just, for our intents and purposes, you can enter drugs. You could enter doctors' names, but that, for a quick quote, is not really necessary for our conversation. We have another option discussing what our average bronze, silver, and gold plans are going to be. And then we could see all of our plans listed here. So we can see that our My Blue at a $0 monthly premium based on what the cost of the plan was. We have our $0 cost bronze plans, and then we see we have the competition of AM Better. We have our competition of Molina, and then we go back and we don't see anything but Florida Blue, Molina, and AM Better. Now, where we get into some difficulties is when we get into the silver plans. If we're sorting by premium, you could sort by deductible. We could look at, obviously, health and dental plans. You can click two plans and put them next to each other and compare these plans as well. All right, so when you go through this, really what you have to understand is what is the conversation piece going to be if you've got a customer that's looking at AM Better and then they're also looking at Florida Blue. Access to care, covering the whole state, a mutually held company, owned by the policyholders. Are you going to be able to get those claims paid for? Are you going to be able to get into a doctor? And really the biggest thing that I could say to you is, quite frankly, have you ever freaking heard of them before? And some of them may. Some of you that have been in the business before know AM Better, a Centene company. We know that they've got Celtic. They were here. They were gone. They were around. They're finished. They're here. Small, narrow networks, just as we have as well, but lack of choice. Also, lack of the ability to help the entire state of Florida, only picking and choosing the counties that they're operating in. I mean, that may matter to some people. It may not matter to others. What you also have to understand is look at the benefits. So when we get into our silver plans, you're going to notice some different things that you may have seen before. If we're looking at our C variant plan, we've got a $25 plan here. We've got AM Better on a silver plan, 0 deductible, lower out of pocket. when you compare the two plans and you really start getting into it on the balanced care, then what you're going to want to really do is you're going to want to make sure that you're looking at some of those subtle details. And some of this is just not going to matter to some people. There are some people that are not going to care that their doctor is not in network with AM Better. There are some people that are not going to care about gaining access under Molina. And you can Google and go out to the interweb and take a look at some of the complaints on the access. Yeah, we've got complaints as well. However, we've got 700,000 members, and they don't. So how do we have less complaints that they do, and what are our complaints? Our complaints are about billing issues, but it's not about not getting into the doctor. It's not about not getting claims paid. It's not about access. And these are a big thing with AM Better, as you'll see here, is 20% in the emergency room as opposed to a copay. That's a big deal for someone paying $20 or $30 a month. So you're telling me that, you know, I'm going to be responsible for 20% of the bill in this particular example if they were comparing these two plans, where if I'm with Florida Blue, I've got a copay. $1 more for your generic drugs, not going to break you. We have our first visits are going to be free on our HMO, and then they're $1. So that's where I say you must make sure that you're addressing the basic pricing here, addressing the competition, but as all of you have in your Dropbox, you have access to all of the plans. And if you're looking at the My Blue plans, you have to understand what My Blue plans are going to have what benefits. So many of you are using the matrix. So we have the matrix here. If I was just to pull up the matrix, so that way we can look at it really quickly together. We know if we were looking at the My Blue plan and we're looking at a 1604, I come back into my drive. By the miracles of the interweb and technology, we can come through here and we know that we're looking at a 1604C. Okay, so this is not the plan. We have to scroll our eyes down to the C, A, B, and C if you're using the matrix. When you can come down here, you can see the first 3 doctor visits are free, and then it is $1. Can you afford to find some spare change on the bottom of your car? Can you afford to find some spare change while you're walking down the street? You can go to the doctor, and that's on your 4th visit, because you're going to have 3 visits that are going to be free, plus you're going to have your regular wellness checkup that is going to be free. You're going to be able to have access to, in this particular scenario, clinicianistas. We have clinicianistas in Hillsborough County as well. But look at the other benefits. That's really what's important. And looking at some of these details, and I'll tell you, depending on the communities that you're working with, the $100 copay in the emergency room is a very valuable feature to talk about. That's how many of our highly subsidized individuals, unfortunately, treat their medical. You're going to urge them to go to the doctor for their free visit. Of course, you're going to want them to use that. But knowing that they're going to have a $100 copay does help them greatly. It's important that you're able to migrate these conversations with the competition. It's important that you understand our product portfolio and how our portfolio works. Has anybody had any problems with this type of understanding? This may be remedial for some of you. I do apologize for the remedial nature. However, I think it's a valuable conversation that we have, because we should be really busy now. We should be setting up appointments, talking to our current membership, looking for new membership, email marketing, phone calls, whatever you're doing to get people involved. I know a lot of you may be working with some of our groups that have local presence. What are you doing in your local presence to get this messaging out there? Do you have your flyers? Are you out there? Are you talking to the local community? Are you doing mailings? And what is that conversation coming about? So I know many of you have got retail locations. Are you getting people into the offices? Are you just sitting there? Are you just waiting for them to walk in the door? Do you think that's going to happen? Or are you going out there and getting it? Are you going out there and trying to find that opportunity? Because the last time I know, there's a good commercial that I really like on TV, and it says, "I love it when opportunity knocks." And then they got Opportunity has never knocked on my door. I had to go out and grab it every frickin' time. And I think most of us on this call in this industry know we have got to go get it. What are you doing to go get it? So, any questions about blind shopping? Speaking to the competition? Speaking to rate increases? I've seen a whole bunch of Facebook posts recently that were non-political. It was a beautiful thing because, God, I'm so sick of it. And then when I'm looking at these, I'm looking at these ludicrous, asinine statements that people don't understand how the marketplace works. They don't understand about rate increases and how rate increases are absorbed by subsidies in most scenarios. You know, we had a short, brief conversation by the coffee pot this morning with someone who's going from $6 to $60. Huge rate increase. In the grand scheme of things, $60 is not really that big of a deal. However, we have created a monster. We have created this facade that insurance is supposed to be so inexpensive, and you know, getting a subsidy to the extent that many people are is really difficult, shall we say, to say the least. How do you address the network changes on MyBlue in Miami? Also, is the website updated? I mean, if you're talking about the agent service bulletin that came out that there's going to be 475 providers that are moving, I'm glad for the heads up, and I don't know if it is updated yet because they haven't said that it is updated. I would use the online provider directory as you normally would with the MyBlue network and continue on. Remember, if you're dealing in Miami, we've got two locations for clinicianistas, and there are still plenty of doctors down there for people to service. The online provider directory is all you can go by, so you've got to have some confidence with that. You're going to have to be comfortable with it, and even if you don't have 110% confidence, that's all you've got. You will lose sales and walk away from sales if you don't have the faith. Tyler from First Family is fear-mongering, showing someone premium, not talking about their subsidy, makes me upset. I exactly saw that same post from First Family. He is absolutely doing that. He has actually a quote in there that if we were looking at the quote, he is going through a standardized plan, family of 3 with no subsidy. But they also don't sell Florida Blue. So if First Family is not selling that Florida Blue product, it is fear-mongering. But he's doing a good job. So listen, he's getting activity, right? He's getting people engaged. He's getting people talking about it. Whether it's the wrong thing or not, that's fine. It is scaring people, but it's freaking scary, okay? Because if you don't have a subsidy, the Affordable Care Act is not affordable. We're talking to people that have got premiums with $3,000 a month. Who the hell wants to pay $36,000 a year in in premiums? It's absolutely nuts. If you don't have a lot of money, then it's okay. If you are a hardworking individual and you're doing everything that you can to take care of your family, it is a challenging conversation. But you have to know to get through it. I've got friends of mine who are right on the cusp, making $80,000 a year, a family of 3, paying $600-700 a month for a pre-ACA plan, and they're wanting to change. They can't change because their premium is going to go to $1,100 to have something that's even close to the level of benefits they have in a pre-ACA plan. It's an education process, people. It's making sure that you're grabbing the hand of your client and explaining them how it works, and making sure that you're using all of the tools that you have, making sure that you're using all of the knowledge about how this works to make sure that you're discussing appropriate plans, plan selections. I think this year we're going to have a lot more people on bronze plans. I think that our discussion this year should be, with a lot of our membership, should be about these 0 premium plans with ancillary products. It's not sustainable. It's not sustainable in a capacity where people are paying this much money and having problems. So you need to make sure you're having that conversation. For the low-income population, for anyone that is under 200% of the federal poverty level, there should be no argument whatsoever. You know, anybody who's arguing you about that type of help that they're getting, their kids going to kid care, let's talk a little bit to that. That should not be a problem. It's not a bad conversation to have. Kid care is a great opportunity for people. Also making sure that we understand simple choice plans followed by an S. 1700 series followed by an S. Those series of policies are the supplement style plans that you need to be comfortable with. So there's a lot of moving pieces going on. Let's open up to some questions now. Any questions about the portfolio? Are you having difficulties understanding the portfolio, understanding the summaries of benefits, understanding how to present these? I know that most of us are, agency owners, managers on our call today. How are you introducing these plans? Is anybody having any trouble with those basics? Searching for drugs has also come up. Making sure, for example, that you're searching correctly, searching the correct formulary. We did talk a little bit about this on a couple of our calls. Just to review very quickly, if we are in the MyPrime website, if you do have someone that takes medications, and you must simply help them try and identify those medications, we do have to make sure we're mindful of the formulary list that you're accepting. The formulary list that you need to be looking at has changed in name recognition if you're using this site. Now, we're not talking Medicare, so let's not talk about that. So it's not a Part D member. We're going to continue without signing in. We're going to go to our medicines. Then what's going to happen is you're going to see your choices here. Let me remind everyone that we have our VBD formulary is going to be the formulary name for Blue Care, Blue Options, and Blue Select. Remind everyone as well that my Blue formulary is now called the Value Script RX. They have altered that. So please make sure that your teams are aware of that as well. It's working pretty seamlessly when we select our formulary. I like using this system. Many of you may choose different methodology of trying to find drugs. You have your medication guide located on the bottom here. Care Choices, medication guide located on the bottom here. They call it Care Choices on the Florida Blue website. So in the communication that we sent out to everyone, and that notice told you that there are now on the Florida Blue website, if you go to flblue.com, floridablue.com, bcbs.com, they're going to call it Care Choices. Just to make things easy, MyPrime calls it the VBD formulary. Isn't that wonderful? So you're searching for your drug, and then you're looking for your Novolog, or you're looking for your Novolin. You just simply type in your medications here, and then we go through it, and we can see that this is on the drug list, and it shows us that this is a condition care brand. That condition care brand will be represented on your summary of benefits. One of the other conversations that we had was when it was coming to oxys, because nobody takes oxys. When we come to oxys, I want to show you something very clearly, and this was part of our discussion last week. For any of you that didn't make it, you're lucky we're going over it again. For those of you that were here, I apologize for the redundancy. And here's what you need to understand. Look very closely at my screen. Both OxyContins are 5 milligrams. Both are HCl. One is a tablet, one is a capsule. The tablet is not recognized, the capsule is on the, wait, what's going on here? Did I get the 5 minutes? This has changed, of course. What you have to make sure is that the package size, and I'm going to have to make a phone call to Florida Blue right after we get off here. The package size is what makes the difference. Let me show you what this exact same thing looked like just a couple days ago. It's interesting. Gotta love it when I even get surprised in the morning. Woo! All right, hold on for me 1 second. Well, the moral of my story is making sure that you're looking at a capsule versus tablet. In some cases, the capsule and the tablet, the tablet would be covered, the capsule would not be covered. We had sent this out the other day, and we talked about it last week. Let me just see if I can pull this up. This was our network guidance here, and I can show you the screenshots that we had provided last week and our guidance that we were working through. Bear with me while it opens up. The pricing difference is insignificant, Terry, because if it's on the drug list and we are talking an under 65 individual, the price does not matter. The price is just there for total pricing. The reason why one is covered and one is not, according to my last information from Florida Blue, is simply because of this price discrepancy. I had done some screenshots, and this is still loading, and you can see the same thing listed right here. This is for Medicare, but it's still kind of showing you the same thing here. Let's open this up. But you have to be careful on all fronts. This particular example, we were looking for Blue Medicare HMO MyTime, and the 5 milligram capsule is not on the drug list, and the 5 milligram tablet is on the drug list. So the difference being is this is ACA. I'm looking at the VBD formulary. In this notification that we sent out, you can see here capsule and tablet, and the difference is there. It is represented clearly in the formulary itself, you'll see, but a lot of times we don't notice. We just select what we see in the drop-down box, and there are a lot of different options. Sometimes you may want to look and see if one of the other package sizes is available. So, for example, if we're covering 10 milligrams and we weren't covering 5, you could take the 10 and then your member could cut it in half if that was advisable by their physician. Just have to really be careful with this, making sure that you're addressing the drug list, making sure that you're addressing these types of scenarios because it could put you in hot water. Also, just a reminder, there was some network guidance that was sent out for Medicare. There was a job aid that they sent out. I believe Mr. Falco sent that out as well. So you should have that, just talking about what to look at in the formulary, what to look at in the provider directory when we're talking about network affiliation. So there's a lot of stuff going on, a lot of changes. CVS, as we know, is out unless it's for Medicare. Remember, you cannot use CVS on any of our under 65 plans. They are out of network provider for RX. CVS Caremark will still be handling our specialty pharmacies, but that is not the retail location, and it's very important. All right, so any questions? Again, plans. Let's talk a little, any questions about provider directory? Any questions about blind shopping? Next week, once the marketplace opens, we'll spend some more time going through the application process together. Our meeting will be a little bit after things open up, but please make sure that you get in there. I want to advise everyone to advise their teams. Please make sure that you can all get into Florida Blue before the weekend should hit. We are getting notifications that many of you have not completed your certifications to Florida Blue. So you need to make sure that you get out your certificates for the federal marketplace to Florida Blue, okay? If FFM certifications does not have your marketplace certs, you will not be able to process business come November 1st. Do not, I repeat, do not wait until the 31st. I would advise everyone send out a mass email to your entire team. Make sure that they can log in as an agent. Make sure that they can get out to the marketplace. Make sure that your Skillsoft is done. Let's review that one last time before open enrollment, and then it won't come out of my mouth ever again. Can't promise that, but I'm going to hope. So once you log in, especially for new MAAs on the call today, new team members, sorry for the delay here. I'm going as fast as I can. How do you verify if Florida Blue has got your certificates? If you can log in, then you can get to the marketplace, then you don't need to worry about it. You're good. So if we come in here, I go to process an application. That's going to bring me to our home screen. I'm going to go here. I'm going to then launch to the marketplace. Once I go out to the marketplace, as you see, my tab will open on the top. It will bring me to the marketplace. If you can't get here, your certificates are not in. Okay? You'll then put in your password. Remember, this is the username and password combination that you have located on portal, cms.gov. Select the images with the CAPTCHA if necessary, all that have mountains. That looks like a mountain. That looks like a mountain. That looks like a mountain. I don't think there's any other mountains. Verify. Great. I'm not a robot. Fantastic. Log in. It will then authenticate based upon my credentialing, and now I am in the application process. As we know and has been sent by guidance and in Skillsoft, that is what you need to do. Then we will look for the application. We will search to see if our customer has an application currently on the marketplace. Selecting our coverage year, because if we're going to be doing renewals, we'll go through this again. We click search and we try and find our applicant. At that point, we would be updating his application for 2017, or we will create a new application if this is not the right John Doe. If this was the right John Doe, I would be working off of here. If it was the wrong John Doe, I would click create a new application and brought straight into the application process. Those of you that have yet to complete Skillsoft in your sales and training, which can be found from your home screen, you have sales and training on the top. Again, if you haven't been on these calls, thank you for joining today. But you've got your agent toolkit, which is valuable information. You should have read through this. Seasoned agents even need to spend some time on this. We have our access to our Skillsoft link here. And this Skillsoft needs to be completed. And it needs to be completed not with the generic information that Gigi has provided you for training, but your own as well. Now, as your own, you must complete the compliance module, which is the first module that you will see. That is the required module for the marketplace. If you recently got your license, then you have more time to complete it. If you are a seasoned agent, it should have been done by October the 15th. They will be looking through that. Will we get paid for third-party vendor enrollments or if phone called directly to the marketplace, as long as it is not a renewal? If it is a Florida Blue current member and they enroll through a third-party vendor, you will not be paid. If they renew over the phone directly with the marketplace, you will not be paid. And you have to keep in mind that even all of those third-party vendors will have CAPTCHA. So it's not going to be as easy as it was before. Trust me, we know all about it. We work through it a lot. But you're still going to have to go out. A few have ruined it for the masses. So again, just making sure everybody knows how we process business. I just showed you the steps. We should know how to do renewals is going to be the same way. Off-marketplace renewals should be very simple. Everybody should be getting into that. I had an email the other day that said, oh my goodness, I go to do a renewal and it's asking me for the member number and the social. Yes, you need that information to do the renewal. There have been a few instances when someone says I put in a member number, a social, and a date of birth and it doesn't come up. It may not be an active policy. You may have the wrong social. They may have the wrong date of birth on file or social on file. That's when it's time to pick up the phone and call agent services. So those are, things that you'll have to resolve. We are waiting for business rules from Florida Blue, so we'll have some business rules with AOR, business rules surrounding payments and different things of that nature. But all of the payment methodology, the job aids are out there, so you should already be well aware of that. Any questions? Anyone? You need to speak, Holly, you need to speak with your agency owner. You got it. Orlando, you got that answered. All right, any other questions that we have? Medicare seems to be going pretty steadily. Tele-app completion method will now be available on the marketplace. I don't understand your question, Justin. Tele-app, I don't understand your question. You'll please have to advise, because people call tele-apps all different kinds of things. You can call the marketplace and they can do an application. If it's a new piece of business, you can do an application that way. However, if that is a Florida Blue member, you will not be compensated as an active renewal for that member if that is done in that method. Again, you cannot complete an application without the member being on a Join Me. If they don't have access to a computer, smartphone, tablet, or any other source, they can go to a friend's house, but they have to have material knowledge of that application and be signing it. You can't do it over the phone and just say, thank you for your business. You're signing a legal and binding document. Don't try and get cute. Don't try and take your book of business and say, oh, I'm going to renew my members. You get caught with your pants down, they will terminate you. It is grounds for termination because, again, you're signing a binding document without the knowledge of the member. That's a problem. So, Justin, if completing an IST, can you select the tele-app, collect the signature, or must be on a Join Me? Justin, we reviewed the different types of methodology that you can do the enrollment. Tele-app is not actually a tele-app on there. It is a telephonic application, and what that means is that I complete the application, the member is sent an email. While you are on the telephone with the member, you give them the 6-digit code that is generated when the application is completed. They will need that 6-digit code in order to open the application. They will verify basic demographics, and then they will sign the application. That is the telephonic app process. The name doesn't make sense, okay? I didn't make it up. If it was me, I wouldn't call it that, but that's what they came up with. Infinite wisdom of Florida Blue. Option 2 is web share, and it says web share, screen share. That is going to be the web application. That is going to be where you're going to enter in the Join Me code or your WebEx code or whatever code you've got showing that you've got the member on the policy. Excuse me, on the computer, and they're seeing it. Third option is going to be the, it says online. Doesn't make any sense again. I didn't make up the names. Online. That online application means that you're doing it together, sitting with your member. They are in your office, and the member is putting their fingers on the computer to sign the application. And then last but not least, you can call the marketplace with the current person on the phone. However, if it's a current Blue member, if it's a multiple tax household, not supported through IST, you won't get paid for an active renewal on that. If a client has a 1505 from 2016, wants to keep it, we write a brand new application with the new premium, enter a binder? No. If they are on a 1505 for 2016, they're staying on a 1505 for 2017, they are not required to collect a binder. There's no binder necessary. This was in multiple job aids that was sent out. We sent out payment information to everyone as well. And the cheat sheet, I believe Mr. Falco shared with everyone on how to make payments. And with that making of the payments, all of that information can also be found here in the agent toolkit, when to make payments and when to collect those payments. Very important that you're comfortable with it. Very important that you understand it, because you don't want to be collecting binders and collecting money for people that don't need it. The delayed payment option is available out there, so if there is a binder necessary, if they're changing networks, then you need a binder, Orlando. And if you're doing that, if you're changing the networks, then you need to collect that binder, and you are able to push the binder date out to a selected date of your choice. So, for example, I'm doing on November 1st, I'm doing my application for my member, switching from the Blue Select to My Blue. When I'm making that change, I do need to collect a binder. However, they just paid their November premium. They don't have the money to pay the next one. You'll be able to push that binder out until sometime in December, as long as it is before the effective date of the policy, and they will charge them at that time. In order to get paid, the policy will have to effectuate. on an active renewal. Do the Blue Options S plans use a different network? No, they don't. Blue Options is Blue Options. It's just the benefits that are different. So if we do contract maintenance on a client renewing, I don't collect a binder. That is correct. No off-marketplace people need a binder for renewal. Clearly stated in the job aid, clearly stated in our communications to everyone, not necessary. If we sign up a member for December 1st, do we have to turn around and renew them for January 1st? If they are an SEP for December 1st, the answer is yes. You would have to renew that person as well if you want to get paid the new business as well as the active renewal. Justin's question, for a multi-tax household, can you just do separate apps for each? The answer is no, because you will not be maximizing the subsidy and you will get the incorrect subsidy amount. It has to be done on the marketplace. You must separate the people into groups. We talked about that last year. So if it's an adult mother or an adult child, that's how you do that. If a client is on the marketplace for 2016 and no subsidy, can they reapply for 2017 off marketplace or off exchange so they don't need to notify the marketplace? So they do have, if they're on marketplace, I don't advise switching them on to off or off to on. Wherever they're at now, I would leave them because you're just inviting more problems in that communication with wrong policies getting terminated. You know, it's not a perfect system, and because it's not a perfect system, I would leave it. If they're on marketplace now with no subsidy, just leave it. What's the difference? Why bother? What advantages is that person going to have? You're just causing yourself additional customer service work, and that's just the problem. Also, flexibility. Maybe they want a MyBlue. That MyBlue plan won't be available off marketplace. Dwayne, you can get with you on that. If a client turns 65 in June and rolls to Medicare, is there a chargeback? Of course there's a chargeback. They're not on the policy anymore. You're going to get charged back for that, and then when you write them the Florida Blue Medicare policy, mind you, you'll get commissioned on that. So, yeah, you will get a chargeback because they didn't keep it for the full 12 months. Good questions, everybody. What other questions might we have? These are great engagement questions, process questions. These details are priceless. Hopefully you're paying attention and you guys have other questions. Please, this is why we love to do these calls. This is all about you guys. Actually, I just like to hear myself talk. That's why I do these calls. Giggy's laughing. I'm kidding. All right. Any other questions? Otherwise, I'm going to let everybody go. I know we're all super busy and everybody's got to run. Medicare appointments galore. All right. Thank you, everybody, for your time. We'll talk to you all next week. It's open enrollment. Get some sleep because you're going to need it. You're going to need your rest. We'll talk to everybody soon. Thank you very much. Have a great day.